Which numbers should we look at right now, Dr. Adalja? Which ones have the most transparency, the most view of how things are getting better?
The hospitalizations, that's something that is sort of binary. Either you're in the hospital or you're not. This is a number that's well tracked. It doesn't depend upon testing levels. It doesn't depend upon any kind of adjudication. So when you look at hospitalizations, I do think we're in a better place. The question is this sustainable? But I can see it in the numbers. I worked yesterday in the hospital. I can just tell by the pace and the cadence of the patients that there is something going on, and I think it's a good thing. And hopefully it continues this way and we don't get derailed and vaccination keeps up with the pace and we stay ahead of the variants. But it does look okay in the hospitals right now, better than it has for several months.
Doctor, relatively speaking, of course, I think we share that view. Good news starting to come out in the last couple of weeks. You mentioned the new variations, the new strains. How well are we tracking them in America right now?
Not very well. I think we really only do kind of a drop in the bucket or the tip of the iceberg. We just get a certain percentage of our tests are getting sequenced, so we really don't know what level of prevalence we have of any of these variants. So whatever numbers you look at on the CDC dashboard, we know that those are an underestimate, that they're not all getting tested. And we have likely more UK variant here than we've actually counted. So that's going to be the big if, is how much these spread and if they actually translate into more cases, more hospitalizations, and more deaths. And the goal, though, is to stay ahead of them with the vaccination rollout. And we have hit over 2 million vaccine doses a couple of days ago. So we are doing well in that standpoint, not well enough because it is basically a race to the end with this variant.
The race, this is what a lot of people have been talking about. Amesh, how big is the risk that we lose this race and that the variants take over and there's a new wave, the vaccinations are not sufficient to really protect against these, and then there's a new variation that just builds on itself? I mean, how close are we to that cycle?
Well, the issue really is not about getting everybody vaccinated ahead of the UK variant. The UK variant is going to become dominant just by simple Darwinian laws. This is going to be the strain that most people contend with after some time. But the key is getting the vulnerable populations vaccinated, those people who get hospitalized, who get severe illness, or who die, because that's what this vaccine is about. It's not about making COVID go away. We're not getting to COVID zero. This is an efficiently spreading respiratory virus. It's about defanging it or taming it so that we never see it put hospitals into crisis. We never see it kill again. So if we can get our nursing home patients vaccinated, if we can get the community dwelling elderly vaccinated, then I think, yes, the new variant is here and it's causing cases, but it doesn't cause the same damage that we're dealing with now, with people dying from this in the thousands per day. That's the goal here, is to get to get this virus looking like the other coronaviruses that cause 25% of our common colds through vaccination.
A lot of people are saying that in some ways this could have been so much worse had this coronavirus been more virulent, and this will not be the last pandemic. How close are we to having a vaccine that's easily adaptable to the new strains that come out and to potentially new variations of coronavirus that do emerge from a zoonotic transmission or elsewhere?
So the thing is that they used vaccine platform technologies, all of the companies, Moderna, Pfizer, AstraZeneca, Johnson & Johnson. That makes them very easy to plug and play. So you can update those vaccines against other coronaviruses pretty simply. And it's now something that we're already starting to do. The companies are starting to make these types of changes. It's unclear when they're going to need to deploy them or if we're going to need to deploy them, because the vaccines, even though they may have problems against certain variants like the 135 in South Africa, they're still able to prevent what matters: severe disease, hospitalization, and death. So I think we've got to make a kind of a policy decision. Is that good enough to be able to stop the severe consequences? Or are we trying to really decrease spread? And then if it's decreased spread, then I think you have to think about updating the vaccines. But if it's just the severe consequences, then I think we're in good shape with all of these vaccines.
Doctor, before we go, I'd just like to compare and contrast what's happening in the UK and the United States right now. We have access to the same vaccines, but we're using them differently. So here's the data from the US that we track. I'm sure you're familiar with it, of course. 11.9% of the population has had at least one shot, 4.5% fully vaccinated. You compare that to the UK, and it is really, really interesting. 22.9% have had one shot, and fewer than 1% of the population has been fully vaccinated. Doctor, do you have a view on the best way to use the doses available to you?
I do think that we need to get first doses into as many people as possible, and our second doses will come. I think the goal is to have our second doses occur on time, but if they come a little bit late, that's okay, because we know they're going to get protection. I think that the UK has a little bit of a difference because they are using other vaccines like the AstraZeneca, where there may be data about increasing the time span between the two and doing mixing and matching. All of that needs to be data driven. I don't think we know exactly how to do it, but the goal, I think, should be to not wait for second doses, to get as many first doses into people, and then make sure people get the second dose. But not having things stuck on a shelf waiting for people to come back for their second dose, but putting those into arms, I think that should be the primary goal, and let the manufacturing catch up.